Hello everyone, welcome to NGR 6367, deliverable 2 oral debrief of on challenging differential diagnosis. So it's my pleasure to participate in this broadcast discussion. My presented case details the clinical story of a 49-year-old female who had experienced cervical cancer and both generalized anxiety disorder and depression. She visited our clinic due to constant heat intolerance symptoms, alongside recurrent palpitations she experienced during the past 3 months. A cardiologist, from a previous evaluation, found no heart structural issues, and her symptoms were initially attributed to anxiety. However, through continuous investigation, we uncovered that hyperthyroidism served as the basic issue responsible for the patient's symptoms. The presenting symptoms created a major diagnostic problem due to the similar manifestations. Symptoms of hyperthyroidism mimic those of anxiety through their shared effects of palpitation, along with restlessness and weight loss occurrences. As a primary care provider, particularly for aging adults and frail individuals with post-cancer diagnosis, one must be cautious about depending too heavily on prior diagnosis and preventing diagnostic anchoring. This patient experienced varied mental health problems at first, but her symptoms persisted even after proper medical intervention signaled a problem. The differential diagnosis included hyperthyroidism, anxiety, premenopause, drug side effects, and even pheochromocytoma. Hyperthyroidism emerged as the primary diagnostic consideration following physical examination findings of persistent tachycardia, warm, moist skin, and slightly enlarged thyroid. The diagnosis of hyperthyroidism became certain through clinical findings and laboratory results that showed very low TSH coupled with elevated FeTrA4 values, which support American Thyroid Association diagnostic criteria. This diagnosis serves as a lesson that evaluating physiological problems should remain a priority even when mental health treatment is active. Premenopause was also thought to be a possibility because this transition commonly occurs in this patient group and features hot flashes as well as mood changes. But this became less likely due to the thyroid findings. The side effects of these medications could be another reason to consider, particularly in the instance since she was on citalopram. Selective serotonin reuptake inhibitors are acknowledged to cause sweating and agitation but are usually not metabolically active. Lastly, true rare pheochromocytoma was entertained for its adrenergic-like symptoms. However, her symptoms were more consistent than episodic, and the diagnosis was not supported by the biochemical evidence. The improvement of my capacity to generate precise diagnostic differentials in challenging scenarios occurred through a combination of clinical experience and continuing educational and reflective practice. Early in my practice career, I heavily depended on superficial diagnosis while ignoring existing but less noticeable medical conditions. I found success through employing guided reflection framework that assist healthcare professionals in turning their attention to patient information above superficial interpretations. I also participated in diagnostic workshops utilizing simulated patients, during which I improved my diagnostic capability and pattern recognition skills through this session. Lastly, structured documentation purposes such as SOAP note and evidence-based templates have improved my problem definition skills. Resources like the Guide to Clinical Documentation and workshop training on using an ICD-10 language help in making my note more focused, defensible in legality, and clinically relevant. So in conclusion, this case demonstrated just how it was necessary to look beyond the obvious, especially in cases of older adults about whom the patient might have multiple health histories. At first glance, psychiatric overlay may make hyperthyroidism just less obvious, but staying vigilant and critical in the thought process is our responsibility. Differential diagnosis function beyond being simple, least since the present both are continuous. Thank you for listening.